thankful to be invited to talk with you all today. And it's been a while, thanks pandemic. It's been several years, and I'm just grateful to be here. I want to thank you all for coming. I'm an independent agent. I've been doing this for about 25 years. I'm not married to any insurance company. I'm married to my wife for 37 years.
Well,
Very, very blessed. I have a couple of kiddos that are empty nesters, and both are married, and employed. So I'm excited about that. Again, I'm an independent agent, and I have hundreds of wonderful clients here at Robson Ranch. Some are here today, and I want to thank you for coming. I do value you. I do value our relationship and business relationship, and I hope to gain more. My motto is to do what's in your best interest, and I do value I do value a relationship, and my thing is I want to be a good steward of that. And so, that being said, this is a reminder. Because of Medicare rules, this event is for educational purposes only. So what that means is I'm not here representing insurance companies and benefits and this company and that. This is all about you. Y'all get enough of that, myself included, from commercials that confuse people with Medicare, spam calls, unwanted sales solicitations, radio. I won't mention celebrities' names, but it just is ridiculous. And so because this is an educational only, that's how we're going to do it, because this is all about you all. Medicare is our country's health insurance program for people 65 and older, for those that are younger than 65 that might have a health challenge, and for those with end-stage renal disease. Let me ask you this, just for my, so I can address your questions. Is anybody here not on Medicare? No. Okay. So I'm going to go over everything. If there are any specific questions, again, we can talk about afterwards. So we'll take the people that are not on Medicare. When do you sign up? Initial enrollment period. Initial enrollment period is on your 65th birthday, 3 months before you turn 65, and the month that you turn 65 and 3 months after you can sign up for Medicare. So what that means is you sign up for Medicare A and Medicare B. Now you got to be careful with Medicare B. So we'll address that in a little bit. Come on in. You have a general enrollment period. So that means is if you missed your initial enrollment period, you still can enroll in Medicare. That's from January through March, with an effective date of July 1st. So the goal is not to miss your initial enrollment period. Now, some people would qualify for special enrollment. That would be for someone that is not on Medicare, that's past their 65th birthday. Does that apply to anyone here today? Okay, so all right, it does? Okay. So we can talk about that more in detail, and I'll hit the bullet points on that. That would be a special enrollment period, and that's very, very important. How do you sign up for Medicare? Is anyone under 65 that is on Social Security here today? Okay. Under 65 on Social Security. So when you turn 65, Medicare will automatically enroll you in Medicare A and Medicare B. Well, that might not be in your best interest. So what I'm saying is you'll have a one-time open enrollment. You might have a group plan that might cover Medicare Part B. You might want to delay Part B. So in that situation, and I won't go over all of that, you get with me afterwards and I'll discuss what your options are, because that's really important. So Medicare B, you have a one-time with some exceptions to enroll in Medicare B. So that's important. So if anyone and maybe someone you might know that's under 65 that is on Social Security, that's very, very important, because we want to make sure that all of your rights are protected with that. How do you sign up for Medicare? Well, before COVID, you would go into the Social Security office and set an appointment and sign up for Medicare and A&B, but probably the easiest way is similar to how you created a Social Security. Has everybody created a Social Security account online? If not, that's how you sign up for Medicare Online. It's very similar. So you would create a Medicare account. So Medicare only, not Social Security, but Medicare only. So you can do that with Medicare.gov. Make sure it's Medicare.gov, not Medicare.com. You'll end up with some insurance company. But you'd want to make sure that, or you can do it through 800-772-1213. Medicare A, Medicare B. Medicare A is hospitalization. That's normally free. Some people do have to pay for it. That's very rare. Medicare B is your medical services. So A is hospital, B is your doctor's medical services. You do pay a premium for that. The information as far as Medicare Part B, that is decreasing in premium. So that information is not in the Medicare New Book, but it is online, and that Part B premium is decreasing. So there is some good news. We're actually getting some relief from that. So they base the Medicare B premium on your modified adjusted gross income from 2 years ago. So if you've had a change in life situation, you don't have that income that you had 2 years ago, there is a form that you can fill out to get that Part B premium lowered. Now that's between you and Medicare and the IRS and what those numbers are. But if you need that form, I'll be more than happy to send it to you. Oh, by the way, I'm not an employee of Medicare. I'm not an employee of the government. But if you need a government form, I can figure out how to get it to you. Part A, this 1550 this is an assumption. This is if you're on traditional Medicare. So in other words, Medicare is your insurance company, Medicare A and B. Is anyone here just on Medicare A and B without anything else? Okay. So Medicare A, if you were to spend 1 day in a hospital, you would need to pay $1,556 deductible per occurrence. So if you're in a hospital for that 60 days, that is what's coming out of your pocket. The new dollar amount for Medicare A is, I'm sorry, I had this put together, then I just got the numbers. $1,600, so the deductible went up a little bit. Medicare Part B is your medical services. The $233 annual deductible is now $226. So for 2023 is $226. So basically, if you're on traditional Medicare A and B, it's kind of like an 80-20 plan. And so this is your insurance company, Medicare A and B. These numbers have all changed, but this just shows you if you're filing single or joint with modified adjusted gross income. So don't write these numbers down because they've changed for next year, but this kind of gives you a breakdown of what you pay for Part B. Now, regardless of what you're on, you have to pay for Part B. What do you get with A and B, or what you don't get with A and B? And of course, you don't get dental, you don't get vision, prescription drugs, hearing, or help with long-term care. Those are the things you do not deal with regular Medicare A and B. When you delay Part B, again, is anyone delaying Part B? Just one. Okay. Let's go over that one-on-one. Where do you go? Does anyone have an employer group plan now? Okay. Do you stay with your employer group plan? Do you do a Medicare supplement or a Medigap plan, or do you do an adherent plan? The way that I look at this is what's in your best interest. And that's all that matters, is what's in your best interest. You do have choices. If you're a retiree or a union plan, ask questions. Ask questions. Are there co-pays? Does it include a drug plan? This one's super important because there are some group plans that have great drug plans that are superior to some that are in the marketplace. If you opt out, can you opt back in? What's the cost? Does it include dental and vision? Medicare supplement or Medicare Medigap are standardized plans, meaning that any plan that you pick, the benefits have to be the same. There's no difference. The only difference is in premium. So they all offer the same benefits. And so what I'm going to say is that, and I get this question a lot, well, Dan, my Medicare supplement, and I have to say, stop. If you're on a Medicare supplement, your insurance company is Medicare. Remember the red, white, and blue card? That's your insurance. The supplement that you have will shadow Medicare. So if Medicare doesn't cover it, then your supplement's not going to cover it. Does that make sense? I get that question all the time, and I just have to say, remember red, white, and blue Medicare that you paid for, that you're still paying for your B premium, that's your insurance company. The supplement, which are standardized, is going to shadow that. So if like, I'll give you a real life example. If there is like a stem cell transplant for your knee, and it's not covered by Medicare, then the supplement is not going to cover it. Does that make sense? What's the best path? With a supplement, well, let me give you a bullet point that's not there, because I just got a phone call from one of my clients who's moving out of state. He's been my client for several years. He lives in the community here. He doesn't need to do anything. It's going with him. In fact, he has a summer home in another state, which is really important for him, because he is within, his Medicare supplement and his Medicare goes anywhere. He doesn't need referrals, he doesn't need to be in a network. You can see any doctor, any specialist, anywhere in the United States. I have a client that has a special cancer, and the doctor that he sees is in Annapolis, Maryland. He goes there once a year with his Medicare and his supplement to make sure he's okay. So with Medicare, one of the benefits with a supplement is you can go anywhere. With this one criteria, does my physician accept Medicare? That's it. If they accept Medicare, then your supplement can go. Does that make sense? Okay. Here's another one too. You can keep it as long as you pay the premiums on time. They're going to go up. We saw it a lot with COVID when the premiums went up. But my clients that have had serious health challenges, they share with me as an agent the information. I don't get involved in claims, so I don't know. Because of HIPAA rules, unless my clients share with me, but they'll say Dan and they'll give me the X dollar amounts of what's taking place. And they're like, I never want to lose that plan because they've seen what it's done for them. So as long as you pay your premiums on time, you can keep that plan. They cannot raise your rates based on your own claims. So they can only raise it across the board. Fortunately, in this community here, we have very stable rates. So the rates are based on your age, your zip code, sometimes living status, marriages, that type of thing, tobacco, not tobacco, but they cannot raise your rates based on your own claims history. Medicare Advantage. Part C replaces A and B and can include Part D. So what this means is you're still in the Medicare system. If you go Medicare Advantage, you're still in the system. It's just that instead of me saying, popping out red, white, and blue Medicare and a supplement, it's going to be XYZ insurance company. And so it's going to be the hospitalization, doctors, and some of them will include dental and vision and some other parts of that. Usually they're going to be a PPO or an HMO. There's multiple plans in the county, and they include a maximum out-of-pocket. So what that means to you is that if you had a health challenge and you had an expense, similar to what we all had with group plans when we had maximum out-of-pocket, those act the same way. So that depends on the plan that what your maximum out-of-pocket would be. So when you speak with an agent, if this is the route you're going to go, you might say, well, what if I get really sick? What's my maximum out-of-pocket? And that's done on an annual basis. When's it the best path? Their premiums are low, some are zero. You can use that as a backup for a VA. I have clients that are in the VA, they just use that just in case. They don't want to go to the VA, but they want to have something close by. You like a network of physicians. Maybe you're on a low income subsidy or Medicare. I don't think that really applies here, but you might know someone that does. And I will say this, I do pro bono work as well. So if you have parents or neighbors that are not computer savvy and need someone to help them, I'll be more than happy to. By the way, I can't take anything from anybody. So if you ever get an agent that says, I'm going to charge something for, you can't. That's illegal. You can't do it. So I will do pro bono. I'm not just in it for business. I'll do it to help. If you got elderly people that need help with that, I'll be more than happy to do that. Prescription drugs. This is the most confusing part of Medicare. Would everybody agree with that? Okay. Oh, by the way, I skipped something. Can anyone tell me, actually, who signed Medicare into law?
Bill Clinton.
No.
Clinton.
A little before that. What?
Johnson.
LBJ, absolutely. Oh, as a side note, went down to LBJ's ranch this fall, went and did, oh, it's incredible. This is the time to go. Has anybody been there?
Yeah.
Oh, so y'all know, it's incredible. Well, this might not be fair. Who was the first beneficiary?
Was what? I didn't hear.
First beneficiary of Medicare. Truman and his wife. Bess, I think was her name. Elizabeth, Bess. I think she went by Bess, right? Anyway, sorry, I won't bore you with it. But Medicare's been around for a while, and I just wanted to share that with you. Prescription drugs. Now, prescription drugs haven't always been around. So the easiest way to understand prescription plans is they're cost-sharing plans. They're not standardized. They're not standardized at all. You've got formularies. You have pharmacies. You have co-pays, deductibles. This isn't in the formulary, this one is. I will help you regardless. Just send me your information and I'll help you through that. Late enrollment penalties may be imposed. So let's just say I have, someone says, well, Dan, I only take one medicine, I can get good RX, I can pay cash and use good RX. You still need a drug plan. You need a drug plan just in case you have a catastrophic situation. I've had more than I care to have been in that situation. So you kind of need to have that just in case. Just in case. Besides that, if you don't sign up for a drug plan, you have what's called a 63-day credible coverage. If you go past that 63rd day, you have a lifetime penalty. Okay, the coverage gap. Everybody here knows what the donut hole is, right? Remember they said that was going away, the donut? Well, it was just the name was going away. It still exists. It still exists. Now, not to get ahead, but the information recently with legislation passed is hopefully max amount of pocket 2 years from next year is going to be better for us. But who knows? Who knows? Basically, I think the most important part is this first one. Coverage gap begins when you and your drug plan spends 40 or 30. So, what that means is you have a deductible. You pay the deductible. Then you have the copay. You pay the copay. It's super important that when you get your statement either online or through the mail, that you look at it and say, this is what I paid, this is what they paid. That's very, very important. So once you get to 4430, from then 4430 to 7050 is when you pay, and that's when the thing starts over, right? You pay 25% of generic drugs, 25% of name brands, 95% count for out of pocket, to where you get the catastrophic coverage at 7,050. Then you do get some relief. So the goal is to try to keep you out of that as best as possible. And there are some different plans that have what they call coverage through the gap. It's important that you put your prescriptions in, and I can help you with that, or I can say, hey, go to, and I can tell you where to go to. All right, I sped through this way faster than I thought. Y'all have any questions?
I have a question on the Medicare D and vets. There was a last statement that said vets didn't need to enroll in the Medicare Part D.
Yeah, so what happens is When you are enrolled in Medicare A and B, then you have that opportunity to enroll, you'll need to do a prescription drug plan, either a prescription drug plan or an Advantage plan that has prescription drug coverage. And you have 63 days from the time that you're enrolled, or the time that you leave your drug plan and you're in Medicare, to enroll into some type of drug plan.
Yes. You had one chart that was time on it, showed the different income levels in which the price varies per person.
Yeah.
So what type of income streams are not included? Is Social Security excluded from?
No, it's included. It literally, and this is above me, it's your modified, whatever is your modified adjusted gross income that you send to the IRS, that you report to the IRS.
Okay, less deductible.
Right, it's modified adjusted gross. Yeah, that's the CPA question.
Those cookies smell
Yeah.
good.
And that was something on A and B, you know, I'm going to we're doing. I still have to get a drug plan.
Yes.
Okay, and what about the ones that single care and all use that? There, you know, there are a lot of drug plans that pharmacies have. You know, single care was one, and something that all use, and then cost plus. It seems like there's several little drug plans.
Okay, so you're in, well, actually, we'll all be in, to answer your question, we're all going to be in annual enrollment period, which starts October 15th through December 7th. So I think your question is, you're going to need to be in a drug plan that is approved by Medicare. So you could like join a pharmacy plan, a discount, is that what you're saying, maybe a discount?
Well, I didn't know. I think a couple times they put me on because I was in the Gap thing.
Oh, okay.
And I tried to use, I didn't use a generic.
Okay.
That was one mistake, but they are expensive medications.
Oh, yeah.
600 a month or something.
Right, right.
Yeah. And there's no way to get rid of that price, you know.
So take my card, send me an email or call me, and we can do it on the phone. I'll put your prescriptions in 5. Now I can't do anything until the 15th. And by the way, any type of phone conversation dealing with Medicare drug plans and with Medicare Advantage, there has to be a disclosure. So you will have to be recorded with, I'll have to record. Like if you call me, I have to do a recording. So if someone's talking to you and they're not doing that, they're not following the rules. And I have my own reasons, and I think everybody in this room probably knows why we have to do that. But anyway, just FYI, like if you call me and we discuss that, I'll have to get a recording, okay? But like I mentioned before, I'll do pro bono. I don't represent every single company, but that's okay. And if I don't represent the company, I'm going to put you in contact with someone who does. If that makes sense? Yes.
May I ask, you mentioned supplements. Is that the same as an Advantage plan?
No. Good. No, that's why I'm here. No. So a supplement or Medigap plan is going to shadow Medicare. So when you pull out your red, white, and blue card, that's Medicare. So your insurance with Medicare, Medigap or Medicare supplement is going to pay that maybe that deductible, that hospital deductible I shared, or that 20% for doctor services. So that is your insurance company. Medicare Advantage is you're still in the system, but instead of you giving Medicare card and a supplement, you'll give them XYZ insurance card. You'll be in a PPO or an HMO for the most part. And then another thing, I think I didn't mention this, is that if you go that route, it's very, very important that your doctors are in the network. Are my prescriptions in the network? Do I travel? You know? Do I have a home somewhere else in the summer? That might not be the best thing for you. So, I mean, that's a really good question. Oh, the other thing too is, and I get this question all the time, Dan, I have a Medicare supplement and I need to wait till October 15th through December 7th to change. And that's not true. You can do that anytime throughout the year. But you have health questions that come in there. So if your premium has gone up, then there might be some underwriting. So I know it's not really applicable for this group today as far as being on Medicare, because you're already on that Medicare. Now there's some trial rights and things that you can take advantage of, depending if you're on Medicare or you're looking at an Advantage plan, and I can talk you through that as well. Yes?
So excuse you mentioned traveling. If you're doing international traveling, would you be best to get insurance for that trip?
Yes.
Okay.
Yes. Nice. So if you're on traditional Medicare and some supplements, you do have international travel.
Okay.
You do have coverage, yes, with Medicare and certain supplements. So I always suggest, because I've had clients that I had one client that gets sick, and she was able to use it, and she's a friend as well, so she's a client and a friend, and she was able to use it, but it was a challenge. So I don't offer those plans, but I probably should. Yeah.
You don't want to get sick overseas.
No.
I'm sorry.
Except certain
The supplement plans, there's different types, like F and G, what are they?
So the rule on that is if you are 65 or on Medicare 2020, so yes, standardized, you might be able to do a Plan F, you just have to talk to me and I can see if that's something that you're eligible for. But Plan G, high deductible Plan G, Plan N, and again, those are all standardized, and it just depends. What's in your best interest? That's really, it's really what it is. What's in your best interest? So yeah, they are standardized. Yes.
Have you actually Plan G and F? Is the difference between those two just the deductible of $226 deductible?
Yes, sir. That's exactly
So
right.
if the premiums for 12 months is greater than the $226, you might go to Plan G. Am I reading that correctly?
You're absolutely right.
Okay.
Yes.
Do all Advantage plans have a maximum out-of-cost coverage? Is that the same with supplemental or Medicare?
So yeah, with Advantage plans, now I can't get into specifics, but with Advantage plans, depending on the plan, there is a maximum out of pocket. With a supplement, no. And by the way, I don't think, is anyone truly just on A and B? Just A and B, no supplement, no Advantage. You might be? Okay. Yeah, talk to me about that. You want to limit. The reason I ask that is because if you're on traditional A and B, that 20% never ends. That never ends. And in fact, now, I have heard that you could actually run out of hospitalization, which doesn't happen very often. I don't even like to bring that up. But everyone here probably knows someone that's spent a long time in the hospital. So that would, talk to me independently, and we'll see, what's in your life.
Do you have any good websites or resources that you can compare and contrast the different plans? Medicare.gov.
You'll get, actually, has everyone got their Medicare in 2023?
Yes.
That's it. You go in the back and look at that.
Okay.
And then, yeah, if you want an opinion, yeah, call me, text me, email me. I'll be more than happy to. Like I said, I don't represent all the companies, but if I don't, I can point you in the right direction. Yes.
So if you opted to take an Advantage plan
Mhm.
and then later wanted to go back to Medicare supplement, can you do that, or are you stuck in Advantage?
You have one trial right. So you have a 12-month trial right. And so, yes, you have a one-time. So when you enroll in Medicare B, that triggers your open enrollment. What that means is you can get into any Medicare supplement anywhere with no health questions. Now, reversing that back to Medicare Advantage, every year, Medicare Advantage, there are no health questions. So the whole thing with Medicare Advantage is doctors, prescriptions, specialists, and what I do is I'll take all that into account and try to figure that out. So So yeah, that's, yeah, you have a trial right. Yeah.
Dan?
I have a question. If I'm on Medicare and I have a supplement, I'm on MD and have a supplement. Now, if I signed up for Advantage, how soon can I be switched over to that?
January 1st.
I have to wait till
So
January 1st.
this, yeah, that's real important because, yeah, October 15th through December 7th, you have that opportunity.
Yeah.
So to do that. So that,
Well, I'm finding that there's no doctors. I've just moved new in the area.
Okay.
No doctors are accepting Medicare alone.
Okay.
So I can't even find a doctor at this point
oh,
to take
okay,
me in.
I'll help you find,
And my daughter has tried everywhere around here.
there might be, well, anyway, that's, call me, all right?
Thank you.
Yes.
My understanding is that if you switch to Advantage from a Med Sup plan, and within a year, and you decide you want to go back, you may or may not be able to go back to the same lettered plan that you had in the past.
You have to go back, you're entitled to go back to what you had.
The same.
Without penalty?
You have 12 months.
Without penalty?
Without penalty, right. Without underwriting, I do personally have a client that is going back from her trial right. So she tried it, she's going back.
I thought there were some stipulations, like atrial fibrillation was one, blood thinners was one. If you were on those, they don't want you back.
You have a trial, everyone has a one-time trial right. So if you're on
They have to take you back, not the same plan that you might have had when.
they have, yeah, you have to go back to the plan that
That's
you.
not what I was told by Blue Cross Blue Shield.
Really?
I was afraid they give you something different too. I really advised them.
Send me an email and I'll send you the documentation.
I have.
You
I
have
what they
to?
sent me, and it says, based on your health or condition.
So you went back within.
My wife.
Went back within 12 months. Okay. There was a supplement.
Yes.
And
Well, she was on the Med Sup,
Mhm.
Plan J, she had an old plan. And then it wouldn't take, they said, if you leave, we will not take you back under J.
Oh, okay. That might, yeah, J might, if they don't offer J any longer, that might be true.
Okay, but there are some plans that are not, people are on that are no longer offered. So you need to make sure you tell people, hey,
Right.
you may or may not be able to go,
Yeah.
if you're happy with it and you leave it, you may be forced to go to a plan that's current now.
Right.
Not what you had.
Okay. Yeah, good. That's a valid,
5, 6, 7 years ago.
right, that's a valid point.
Okay.
On the Medicare.gov, under a lot of the supplements, where it lists different insurance companies, a lot of them I've never heard of. Is there a place where you can go to get rec as far as, respond or reviews, if you want to call it? But which ones pay, which ones are lousy? Or talking to you.
I'll just say this, I only work with companies that have strong AM Best ratings, I'll just leave it at that. Yeah, but that being said though, there are companies out there that, you've never heard of the name, right? But they have a great reputation, or they have a great AM Best rating, so, yeah.
So the Medicare supplements have different levels of premiums and coverage. So you decide which one is best for you. And you change within those supplements without any adverse, like once a year, you don't have things you go to a different one?
No, there is one company, again, this is an educational only, so I can't mention the company, that does have that within the plan. I will say, for the most part, you would have to go through underwriting, depending on that. So what does that mean is, you try to make the best decision you can with the information that you have, because that's really all we can do. Especially, that's a good question, on the drug plans. because you remember, we have October 15th through December 7th. Some of my clients that have some issues, health issues, maybe with prescriptions, I'll say, let's try to wait till the end. Not to procrastinate, but let's just wait till the end to make sure that your prescriptions are going to be, that we have the latest information so we can make a good decision from next year. Does that make sense? Am I making sense? Does that make sense? To kind of wait till the end. So, but to answer your question, no. There is one company that does, and again, I can't mention the company. Yes.
Sorry. You said that there are some companies that are not well-known companies, but are good. But does that mean that every doctor would take that insurance, or do you need to check with your doctor first?
For the most part, everything is done electronically. If you're on Medicare A and B, the supplement shows that they have to take it. Now, they might not file electronically, that you might have to do like that we used to have to do back in the day and do the reimbursement. That might take place if they don't, but for the most part, it's seamless. It's all done electronically.
But if you have an Advantage plan
Right?
with a company that's not a recognized company, meaning one of the top 10, say, does the doctor still have to take that insurance?
Okay, that's a really good question. Because on an Advantage plan, for the most part, those doctors have to sign an agreement that they're in that plan. Okay, there are exceptions. There's PPOs. If you do a PPO, then you'll have what's called a non-network situation. You say, well, I want to go see XYZ physician is not in a network. Now, that being said, if that doctor is not in a network, they don't have to take it. They might say, I'm sorry, we're not going to do it. But you at least have the opportunity to say, will you accept the terms and conditions of this plan? So the whole goal is to get as much information as you can, make the very best decision that you can, knowing that we're not perfect. You know, we just have to deal with the information that we have. So on an Advantage plan, for the most part, we're looking at a network of physicians. And so, I mean, and that's what I do. I will actually call the doctor's office and talk.
If it's a preferred provider, you can go to any doctor.
Within that network, yes.
But it has to be within a network.
Yes.
So an
HMO is you do, that's a really good question. An HMO is where you have a preferred provider, and if you need to see a specialist, then you will need to go to your preferred provider, and they will then refer you on to a specialist. So you cannot do that on your own. You'll have to go through your primary physician. If they're not in the network, and you say, well, they're not in the network, I want to go see them, your insurance will not pay. You'll have to pay on your own.
Okay. It doesn't sound as though there's much difference between a PPO and an HBO. HMO, sorry.
That's okay.
You had it right.
Yes.
I actually had, on 2 different occasions, doctors tell me, I'll just say, I have the Humana, and they say, oh, I'll take you if you have PPO, but I won't take you if you have an HMO. Sorry. So they can actually discriminate. I mean, it's not the, they'll say, oh, I'll take your Humana, but they will not take the HMO. Yeah, and I've had that happen to me on 2 different doctors.
Right. So like, your situation is different than this situation. That's why you want to make sure all the ducks are in a row, if that makes sense. So a PPO is going to give you a little more flexibility. So if you want to see someone that's outside of the network and also not having to go to your physician to do that. That being said, there's a great HMO out there. There's a great one. There's great PPOs. But it's got...
But PPO costs you more. I mean,
the only...
You're paying extra.
Yeah, you might pay a little... Again, I can't get into this too specifics, but in general, you might pay a little more copay for a specialist, a lot of times you won't have anything with a primary. Or if you were gonna have maybe let's say an outpatient surgery, you might pay a little bit more, but the flexibility is you have a little more control over your health. In other words, your doctor, you don't have to go to your doctor to get a referral. Does that make sense?
Right, and that's great, but of course, if you're new to the area, you probably don't know doctors anyway, so you just have to be happy. Yeah, but I think a lot of the insurance companies too charge you more monthly, don't they? I mean, like the Humana, for example, you don't pay any premium, it's just but then if you do the PPO, you will pay some premium. So, I mean, there's all these different things to weigh.
Yeah, depending. Like I said, I can't mention companies, but there are good PPOs that are very low, sometimes zero. Okay?
Okay.
May I say, I know you can't say, the way it was sold to me, a PPO, or presented to me, a PPO is, if there is a catastrophic illness, and who knows when we're going to have a catastrophic illness, the PPO offers you a wider flexibility.
Yeah.
Yeah. Absolutely. You have a little more control.
So am I correct if you, and it only applies, I think, if you, let's say you were on a regional program in the state of Pennsylvania, you move to Texas, that program isn't available.
Correct.
You can switch at that.
Yes.
Okay.
In that situation, I won't bore you with my slides again. That's a special enrollment period.
Right. Okay.
So yeah, that's called a special enrollment period. So anyone that's new to the area, they came out of state or somewhere in the state, and that group is no longer available, then you have what's called a special enrollment period, and you need to do that ASAP.
Yeah.
I had total knee replacement scheduled in April, and Baylor Scott and White, I guess in Keller, is where I was supposed to have my surgery. Well, I was called 2 hours before the date, actually the day before, to not go to that surgery because they did not take Medicare, and the Baylor Scott and Trophy Club did. So it's real important because I figured that the TOS, the Texas Orthopedic Surgeons, which were in the same group, would know which facility did.
Oh, yeah.
So it's real important to ask.
You know, and that's a really good thing too, because if you are, because this has happened to me, okay? If you're gonna have a surgery or something like that, outpatient surgery, and it's usually with anesthesiologists for some reason.
Yeah.
Make sure that they accept it. And if not, say, hey, I read this.
Right.
I have insurance for a reason, right?
Yeah.
Well, we depended on the fact that we're going to this group, and they're in different locations. Why Keller would not, with the same hospital organization, not have the same surgery? I was delayed a week because of it.
Yeah, that's super important. So if you're on traditional Medicare, the whole thing is, especially with specialists, I think it's usually a bigger challenge with primary doctors for whatever reason, is you accept Medicare. You accept Medicare, and you're good. And that supplement or a Medigap is gonna shy away. That's good. And yes, if you are gonna have some type of, like I said, if it's an anesthesia, make sure they all accept the insurance. Right. And that could be for someone that's below 65 as well. Because that happens not just to seniors that are on Medicare, it happens to other people. So.
How do you find out if because you never know the anesthesiologist until you get the bill, basically.
You just,
They tell you about 4 months later.
You just ask and say, look, I have this insurance. This is why I pay for this insurance. And I gotta be careful here.
It happened to me several years ago before I had Medicare.
Oh, yeah?
And basically I was told, you ignore the anesthesiologist bill, just ignore it, and I did.
Yeah,
That's one way.
One thing I really want to emphasize again is do not let these commercials, you get this, you get lunch, you get free shoes, and you get to go to the moon, you know? Don't listen, do not, because and I get them too, y'all, and I have to answer my spam calls. You know why? Because my clients call me, and sometimes it'll show up as a spam. So I have to answer, so I'll get those calls, and I'll try to go through to find out who this is. And I always get hung up on. I always get hung up. So it's some agent, probably, well, never mind.
Thank you, Dan.
Yes, thank you.
Appreciate it.
Thank you.
Thanks, Leah. Thanks for your questions afterwards. Now we have a message